Okay, so we're going to go over chapter 63, and it's a musculoskeletal trauma and surgery. And I'm just going to go over the soft tissue, so we're talking muscles, cartilage, and then we'll get into bone in another video. All right, so let's start off by focusing on our key things. And it occurred to me at some point that I should probably start color coding this a little bit, so we can hit the important parts, and then just the other parts will be in a regular color. Um, Anyways, so that occurred to me a little bit ago. So as far as chapter 63 goes, of course, anything with patient teaching, health disparities, or nursing roles is going to be important, especially healthy people. So, all right, so patient teaching. And again, this has to do with musculoskeletal trauma or surgery. So we're trying to prevent falls and injuries with our musculoskeletal system. All right, so as far as older adults go, reducing rugs, like free rugs that they could fall on, using ramps, assisted devices, making sure that they have the proper shoes. Exercise is always going to be important to help improve coordination. Um, so continuing to exercise and staying away from wet areas and uneven surfaces. Okay. So, reduce weight. That's a big one because they get down a lot. So reduction of weight is going to be big as far as musculoskeletal goes because it's bad for knees, bad for joints, bad for back. Um, and exercise is another one we hit on. Also, and this one, rising slowly. So it's important that we're rising slowly, and the reason why is because, especially with older people, we have orthostatic hypertension, where all of a sudden it just bottoms out, and that's because your body is going from a position of rest to standing, and the blood and the nervous system can't keep up with that fluctuation, and it quickly bottoms out and then has to restore itself. Orthostatic hypertension, of course, it lasts longer than that, but a lot of medications, and especially with older people, have that issue. So rising slowly, and I already hit on avoid uneven and wet surfaces. All right, so healthy people and exercise. Remember, that's healthy people 20, oh yeah, 2020 now. Anyways, so healthy people, and this is involving just exercise, not anything else. And they're saying that exercise is important because it's going to reduce your weight. It's going to increase, sorry about that, increase your bone density. Because again, if we are sedentary, we'll lose bone mass. If you're doing weight-bearing exercise, I can't tell you how many times I've seen people swimming because they're going to improve their um, their bone density and get a better result in their bones. Again, that does not work. All right, so weight bearing exercises will increase your bone density. It of course helps with reduce of high blood pressure. You're going to increase your metabolic rate by increasing your lean mass and reducing the fat. You're also going to have, of course, you want to make sure that you don't lose range of motion. So stretching and flexing is going to be important there. It reduces your risk for heart disease, cancers, and diabetes. And of course, it helps with depression and tension, so that's important as well. Acute soft tissue injuries, and that goes into how it can happen, which seems pretty obvious. You fall, you break, you play sports, and then symptoms or manifestations, and then treatments for that. So your symptoms, and again, I'm not going to hit on actual cause because it seems pretty obvious. All right, so your actual symptoms, of course, and this goes for almost everything, is swelling. If you have swelling, you're going to have heat. Reduction in pulse. All right, so I might have lost my pedal pulse or my ulnar pulse, whatever. Reduction in pulse. Pallor is loss of color, and confusion, which is right underneath that horrible glare. And then ecchymosis, bruise. It's a bruise. And obvious deformities. So your number one thing is obvious deformities. Obvious if the arm's longer, if the leg's longer, if they're gaped off, that's an obvious deformity. If it's twisted the wrong way, my arm is all of a sudden bent backwards this way, it's probably broken or dislocated or supplication or there's something wrong, obviously, with the skeletal system at that point. Now, just so you're tracking, things that are avascular usually don't have a whole lot of swelling. And so as we get into some of our cartilages, you'll see that swelling is not as big a factor, but loss of pulse, pain, swelling for the most part, those are all really off the top of your head, easy ways of identifying things. So, all right, so those are your manifestations. Your treatments is always going to start with ABC, so that's airway, breathing, circulation. Airway, breathing, circulation here. All right, so circulation is going to be the biggest thing here. Circulation is your number one usually, unless of course somebody's fallen and they're not breathing, then of course you're going to start there. But otherwise, you're looking at circulation at this point. Why? Circulation is going to be your top priority as far as your ABCs go when it comes to just musculoskeletal injuries. And the reason why is because without circulation, you're going to have necrosis. Yeah, when you have necrosis, well, that's of course bad. So neurovascular. You want to check your neurovascular. Basically, all that means is neurovascular. You have a nerve, you have a vascular system. Okay, so for most of our structures, our nerve run right in line with its and in line with it's actually a neurovascular bundle. Your nerves run right in line with your arteries and your veins. Of course, your arteries are pushing out, your veins are pulling back. So a lot of times when you have inflammation, swelling, or deformity, if you cut off blood supply, you cut off nerve supply, you cut off nerve supply, you cut off blood supply. So they're kind of work together in that way. So you're checking for sensation, color, pulse. What else could happen if I all of a sudden cut it off a pulse? I might have tingling, I might have sharp pains, I might have radiating pain. So think neurovascular here. Think of what would happen if I hurt my nerve, what would happen if I stop blood flow. That's neurovascular. So you're checking for sensation, color, pulse, tingling, sharp, radiating pain, things of that nature. Rice. Rice is going to be huge here. So rice. RICE stands for, if you're not familiar with it, rest, ice, compression, and elevation. So rest, ice, compression, and elevation pretty much solves all of your problems as far as emergency treatment goes. Again, once you've established ABCs. Bottom line is, as long as it's neuromuscular, you rest, ice, compress, elevate. That's your first priority because you want to get ice on that as soon as you can. Of course, elevation is going to reduce accumulation of fluid in a particular space, and you want to immobilize the joint. Okay, so if my arm's bent this way, all of a sudden, all right, I'm not going to try and realign it and then splint it. No, you splint it, you immobilize it as it lays. So you always immobilize above and below the joint. Of course, you're going to use padding, you might use a sling, but you're going to immobilize as it lays. And of course, if it's an open fracture or something where I've got something jetting out of my body, you might want to close that up before you pad it. So rice it, rest, ice, elevation, compression. That's going to be your emergency always for musculoskeletal. And you can ice it initially. Icing, they say 20 to 30 minutes in your book, but you can really do it for 15. And you only get to do it for like the first 24 hours, the initial treatment, and then you can go to ice heat therapy, or maybe some other type of therapy. And by that point, you've probably got them to a doctor anyways, or orthopedic surgeon, or whatever they need to see. All right, so that is your gist of pretty much your summary of your boxes, actually. So reduce weight, exercise, increase range of motion. All right, obvious deformities are going to be your sign. Rice, ABCs, and then C is going to be your big. All right, so that is your box impression. Let's get through sprain. Don't move forward. And I'm just going to write a couple of things up here on the corner. Again, something that probably should have occurred a long time ago, but it just happened to pop in my head as I was sitting here. So, rice, okay, and then of course ABC, exercise, weight. Okay, those are our big ones for right now. And deformities. All right, so let's start with sprain. A sprain and a strain are not the same thing. So a sprain, a sprain is where we've had some twisting or some crazy force on our system. A sprain is where, like, for instance, if I, and I'm using my hands here because you can't see my legs, but if I was all of a sudden trying to throw this way and something pulled my arm some awkward way, I might experience a strain. And a strain can be classified as first degree, second degree, or third degree. Third degree is I've completely ripped something open, and it has to do with this is a tearing force. Um, yeah, tearing force. And it could have to do with the muscle. I'm sorry, the ligaments. All right, so remember, ligaments attach bone to bone. Tendons attach muscle to bone, and of course, muscles are exactly what they are. So a sprain is a tearing force. It's a violent force. It's a twisting. It's a wrenching. I've torn something. The first degree is going to be a release, and it might just be that you have some swelling. Second degree, you're going to have minimal tearing and more swelling. Third degree, you completely rip that thing in half. And again, it's as I said before, ligaments are generally pretty, but not avascular. So a lot of times you're going to have to actually go in and repair things. So where would you see something like this? A strain might be, and again, I keep referring to this because this is what people usually think of, ACL or PCL. ACL, that's your connecting your femur and your tibia. And a lot of people injure the ACL in sports-related type of activities, mainly because there's a lot of twisting movement there. And when you ripped it completely, again, that's your third and first being your minor. So that's a sprain. Your strain is that I have strained my muscle. I have strained my quadricep, my glute, my lateral dorsal. All right, strain is muscle generally. All right, it can also be fascia or tendon. Okay, so a long time ago, I had ripped off my bicep, my distal bicep. I ripped it, and just so you know, it actually is more down here. But anyways, I ripped it, and what happened was that would have been I only partially ripped it, but you could see an immediate jump of my muscle from here to here, and it was a rip of my tendon. But so your strain, if I were just to do a small movement, or I overextend my arm, then that would be a strain. Okay, it happens generally in big muscle groups, your quadriceps, your lateral dorsal, your pectoral, your glutes. Those are major muscle groups. And it has to do with overstretching. And again, that could be anything from, I just pulled it, or, I pulled it running, I pulled it doing a box jump or something like that. Alright, so avulsion is a complete tear off of the ligament. So if the ligament is completely pulled off, alright, without, so the ligament is completely pulled off at that point, and you're gonna need surgery at that point. So, just going through a couple definitions. Arthrosis, and if you break down that word, you're talking blood and joint. So this is blood in your joint capsule, which of course would have to probably be drained or orthocentesis. But it's blood in your joint. All right. So those are your main ones right there. We'll hit dislocation in a second. But if you have a sprain or strain, go back to your rice. Again, your manifestations are going to be a lot like what I just said already: swelling, pain, disformity, immobilization, tingling, lack of pulse. So those are strains and sprains. Again, sprain, it is a ligament, it's a wrenching force. Strain is less than a sprain, but it has to do with major muscle strengthening. When you go to, when you go to do something with this, rice is your first thing. And when you want to wrap it, like let's say you decide you're going to wrap the extremity to immobilize it, start at the bottom and wrap upwards, so that way that you're pushing fluid back up instead of just wrapping from the bottom down, which is going to trap fluid into a compartment. So that doesn't make any sense. I don't do that. Dislocation is, and then of course Alright, so dislocation is something where it is come out of, like my arm has come out of the socket. you're going to have tearing here. And a lot of times when you have those strains, you're at risk for a dislocation because what's holding in things, it's your muscles, your tendons, your ligaments. If it's not there to hold it together, then nothing's there at all. And a lot of the time that happens with the rotator cuff. Because your rotator cuff is literally held in by these, what we call sit muscles. And when you have, a dislocation, you're going to have tearing because otherwise it would still probably be where it's supposed to be. So a dislocation, it's going to be pretty obvious something's dislocated. 60 to 120 degrees is like a no-go for rotator cuff tear. And I say that because, again, the more mobile you are, the more prone to injury you are, and it happens that your rotator cuff and your hip are pretty much the most mobile things you have. You're going to have swelling, obviously, probably some numbing, tingling sensation. They will not be able to use it in the same manner. Lack of blood supply, and that's going to, of course, change the color. And unfortunately, with any dislocation, you want to make sure that it gets reduced as soon as possible. You can have open or closed reduction. Open is, of course, we cut you open and we're doing some type of surgical insertion to make sure that it gets back in place. Close, I can slam you into the wall, pop it back in. Not in the same skill, but that would be open and closed reduction. You want to make sure that happens as soon as possible because when you have swelling, when things are out of place, you're probably pinching off blood flow, you're probably pinching off nerves, and of course, if you do that too long, you're going to have necrosis, specifically avascular necrosis, lack of blood necrosis. All right. Dislocation, and I need to write this into. Dislocation is an orthopedic emergency. So in ortho world, this is emergency. If someone walked up to me and their arm was obviously out of socket, I've got to be honest, I don't really think it's an emergency. It's just a matter of getting them to some care or getting it back in. But an orthopedic limb, or, as far as that goes, where that's your primary thing, then that's going to be an emergency. And obviously it's a bad thing. It's going to be painful. So it's considered an orthopedic emergency for dislocation. And a lot of that has to do with going back to necrosis. So your not the nurse's first goal. The nurse's first goal is never to realign it. You're not realigning things, okay? But the orthopedic surgeon, orthopedic specialist, their first priority is to realign it to your normal anatomical position. We don't want your armpit like all crazy. So dislocation, you want to get it back in as soon as you can, and you want to make sure that it's realigned as soon as possible. And again, I already hit on open and closed reduction. Unfortunately, again, once you've already pulled, if you've rolled your ankle, let's take an ankle for a second. If you've rolled your ankle, and you will probably continue to roll your ankle because at that point you've stretched out the muscles and ligaments and tendons that hold it stabilized. So the more flexible you are, the more prone to injury you are. That's just kind of the way it goes. So it's a battle between flexing, range of motion, and stretching. So subluxation is a partial dislocation. And again, you're going to see some tearing because things are not where they're supposed to be. Sorry, I just lost my train of thought. This is just a partial dislocation. Not that you still are going to probably have the same manifestations, or swelling, the lack of pulse, your tingling, and numbness, color, things like that. But it's just not fully dislocated. And again, you can use open or closed reduction. But their priority is to make sure that it's realigned and reduced as soon as possible. Your priority is to immobilize as it lays. All right, and of course, pad anything that is open, skin break, and make sure it gets covered. Possibly some antibiotics, depending on what has caused it and whether it was skin tear. Okay, so that's pretty much your sprain, strains, dislocations, and subluxations. And again, once you have something like that happen, you're prone to it a lot more because you've loosened up all those muscles. And of course, PT is going to be a good thing for you at that point because you want to strengthen up those muscles. Repetitive training, let's just go to that. I've lost my. Alright, oh, orthopedic emergency. Dislocation. Try that. Send that up there. Ortho, emergency, dislocation. And I don't mean that this isn't important or that getting the package is important. Or that's not what I mean. I just mean stop thinking. For this chapter specifically, for this chapter, stop thinking my patient can't breathe, my patient's heart is stopping, start thinking circulation here. Alright. Anyways. Alright, so repetitive strain injuries, repetitive strain, and what do we say strain was? The strain is retching, tearing, pulling injury. Repetitive strain injuries, so that we just automatically associate with work. So if you're continually doing the same thing, putting wear on it, you might create small tears, which creates inflammation, and you end up with a repetitive strain injury where you have loss of flow, loss of feeling, loss of blood flow, discoloration, swelling. So repetitive strain injuries, again, from small repetitive motions, and you're going to have small tears. I already said pain, swelling, numbness. Your biggest thing here as a nurse is education, ergonomics, proper posture. The big thing here is prevention. So repetitive strain injuries can, of course, be prevented because you make the choice every single time to do whatever motion it is. I don't care. Tying a bow above your head, picking up a plate above your head. So they really stretch education as far as posture goes, making sure your feet are flat, you're at 90-degree angles, the computer's where it's supposed to be. Ergonomics. Ergonomics in the workplace, strengthening back up that area, making sure you have good posture so you're not slumped over all the time. Alright, and that's repetitive strain injury. Carpal tunnel syndrome is a repetitive strain injury that specifically has to do with the hand. So carpal tunnel syndrome affects the medial nerve. And remember I said your blood and your nose run pretty much running the same way. The volar carpal ligament. Alright, so with carpal tunnel syndrome, basically you've created some type of repetitive motion, and I'm just going to use cutting hair here because that's where I've seen it. Alright, so people cut hair, anyways, people cut hair. So they're cutting hair all the time, the same exact motion, just this motion right here. And eventually this ligament right here, which wraps around, cuts off circulation to a nerve that goes down your hand right here. Alright, so it goes from, alright, so when I tighten this band, the ligament that goes around my wrist, I'm cutting off nerve and my medial nerve that goes right here. Alright, and what happens is when I do that, I lose sensation in these two fingers and blood flow. And again, with the buildup of that tendon, your volar carpal ligament, so that ligament, again, ligaments attached bone to bone, when that ligament gets bigger, I lose sensation in these fingers, numbness, swelling, tingling, loss of strength. There's a couple of signs, so a couple of diagnostic ways to check for this, and that's basically both of the female sign and your palm sign. Both of these are creating some type of tingling. So basically we're reducing blood flow more through these two diagnostic tests to try and see if it is an issue. So with your Tenial, they're tapping on this medial nerve and seeing if it goes numb down here. Alright, well for a normal person that doesn't have an already decreased blood flow, you're going to be fine. But for somebody with carpal tunnel who already has decreased blood flow and who's hitting that nerve, then it's going to get all tingly down here. Alright, the other one is a flexion. Alright, so the wrist flips down and holding it there for 60 seconds and seeing if the fingers get numb here. So those are your two diagnostic tests for that. Usually it's identify the cause, reduce the cause, physical therapy, NSAIDs, rice, splint, things like that. But you do have a surgery that's available for that. And when you have that surgery, basically, it's endoscopic surgery, and they're cutting that ligament to try and relieve pressure there. So it's like an immediate release because all of a sudden you can feel these, but it does take a long time to recover from it. The when you have any of these repetitive strains, because remember I said repetitive strain is going to create inflammation, it's going to create nerve damage, cell damage. But if you already have like diabetes, peripheral nerve disease, you've already got reduced blood flow for whatever reason, obviously these are going to be more prone in those particular people. So, all right, rotator cuff. Rotator cuffs come up a lot as far as, well, I guess mine will, but anyways. So rotator cuffs, basically, you have what I call the sit muscles, or what I've been taught with the sit muscles. Your supraspinatus, infraspinatus, teres minor, and subscapularis muscle. You don't need to know this, I don't think. But either way, it holds in that shoulder into place. When you have a rip in one of those four muscles that help hold in that thing, it again, can't, very painful to lift it from 60 degrees to 120 degrees. Will be excruciating or impossible. If you get somebody's arm to 90 degrees, and then it'll just fall. And again, with all of these, I forgot to mention that, sorry. With all of these, it all depends on how bad the tear is. Alright, so your treatment manifestation all depends on the severity of the tear. So it could be very minor. It could be just a, put an ice pack on it and drive on. Or it could be that it's completely, you just look at it. So, rotator cuff, your supraspinatus, infraspinatus, teres minor, and subscapularis muscles. So abduction, your sits muscle. Supraspinatus, infraspinatus, teres minor, and subscapularis. All right, so just to give you an idea, your supraspinatus is here, your infraspinatus is down, your teres minor is actually part of your chest muscle, and your subscapularis, well, guess what it's under? It's underneath your scapula. Those are your sits muscles, and depending on how bad your tear is, you could get away with corticosteroids and some NSAIDs, or you might have to have that surgically repaired, where they're stitching back the muscles together. If it's really bad, then you actually, and I've never actually heard of anyone having this, but you have your AC joint, your acromioclavicular joint in here. And if it's really bad, they will remove part of your acromial process to reduce the pressure, which I thought was really crazy, but I've never heard that. So it's called acromioplasty, and again, they remove part of your acromial process if it's really bad. Otherwise, they're going to try and use PT, they're going to use NSAID, they're going to use ice, they're going to try and immobilize. With anything, and that's another thing I forgot to say, with any of this stuff, get them up and get them moving. Alright, if you don't do your PT with your rotator cuff, you'll end up with a frozen shoulder, which means it will be not mobile at all. So that sucks, you don't want to do that. MRI will be used for a lot of this soft tissue diagnosis, so MRI. And yeah, that pretty much sums up your rotator cuff. Yeah. Alright, meniscus, let's move on. So your meniscus is a fibrous cartilage shaped kind of like a curvature, a crescent shape. Most familiar in the knee, of course, but it doesn't have to just be the knee. You see what's happening. It's fibrous, and it's crescent shaped. Again, avascular. Some people can tear or shear this. Usually this is a sports injury where they have some twisting motion in their knee. But sometimes you can just get away with not having the surgery. If it's really bad, then you might have to have the surgery. But a lot of people just live with it. And again, it doesn't swell much because it's very, very avascular. But people generally on extension, so let's say this is my femur and this is my lower leg, it will hear a pop, pop, or a click, 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 click. Generally indicates a meniscus tear. Not preface, but an actual, it's a different sound. So, The causes, again, meniscus tear. A lot of times you'll have your foot planted in your turn. That's such as the case with ACL. But a lot of sports injuries, a lot of things where you're squatting on your feet, or of course in older people you're going to have cartilage breakdown. So, and like I said before, fibrous cartilage is one that impacts one that absorbs impact. So you see in the disc, you'll see in the areas that need to be impacted, and your knees take a lot of the brunt of that. So, and again, this is diagnosed with MRI. The same thing again, rice it and evaluate it. Arthroscopic surgery for fixing it if it's really bad enough that it needs to be fixed. Arthroscopic surgery for severe tear. All right, so that's your meniscus. The and PT is always going to be important. And of course, PT is going to make them get up and get out and start moving and then you need to do it, otherwise you'll lose significant function. All right, so let's go under our ACL, which is more appropriately called our anterior. I can actually look at this cruciate ligament. And to give you a gist of it, so here's your upper bone, here's your femur, and the tendon goes that way. I'm sorry, the tendon, the ligament. Here's your lower leg, somewhere in there. You have one that goes this direction and is in front, and that's usually that's your ACL, and that's usually this one. And you have one that gets in back. It doesn't get that's your posterior one, and it doesn't get torn quite as much. If it gets torn, it's a really bad injury usually. Not fun. Or from the posterior side of it. Either way, this is a lot of times. This is like I've got foot planted and I'm twisting. You see it a lot in soccer, football, things like that. Or landing wrong. I've seen that too. All right, so that's your ACL. And it says immobilize. You're going to need surgery for this. But again, initially rice it to get them evaluated with your orthopedic. You're going to need to have surgery for this. This can be a minor scopic surgery, but either way, it's usually going to have to get replaced because it's not fun. And a lot of times, the entire ligament is replaced actually. All right, so with bursitis, I already talked about the bursal sacs, or like a sac filled with synovial fluid, and you find those to reduce friction or help gliding. You see them in your shoulder, some of your fingers, in between your patella. Again, it's not a synovial joint. Don't confuse it with a synovial joint because it's actually different. Synovial joint encapsulates a joint. Bursa is its own sac on its own. It's like an implant of synovial fluid. Right? So that's a good bursitis. Bursitis, of course, is inflammation of the bursal sac. You can see that with rheumatoid arthritis, repetitive motion. It can happen with infection. So again, this is something wrong with your bursal sac. So this can happen with infection, rheumatoid arthritis, trauma, repetitive motion. For instance, a baseball player throwing overhead constantly. So it can have bursitis from that. It can be drained if it's painful. It can be drained or if it's infected. You want to find the cause. Usually this is not one of those things where it's like all of a sudden it's just out of control. This is a slowly progressing thing. So you want to find the cause and reduce the cause, obviously. Overhead motions usually account for that, weightlifting, things like that. Overhead motions. And if it's really, really bad, they'll remove it. But it's usually got to be. I have seen where bursa sacs have literally popped outside of it, and they've gone to the outside, so you can press the bursa sac on the skin. This huge bulge. Anyways, it's usually got to be pretty bad for them to remove it. Also in gout. Alright, so that's all your soft tissue for chapter 63, and we'll hit fractures in the next video.